Hi everyone! Welcome to this birth class video lecture. I am student nurse Cherish.
Ayen student nurse Christia.
I am student nurse Ria.
I am student nurse Ayen.
And I am student nurse Chela, and we are from UST College of Nursing.
In this video, we are going to talk about childbirth.
This is especially important to pregnant women so that they would know what to expect during the journey of childbirth.
So we will be going through 5 topics. First is the signs of true and false labor. Second, the labor basics or stages of labor. Third, managing labor pain. Fourth, what happens during labor and delivery in the Philippines. And last is the EINC protocols.
We hope that we would be able to teach and instill these learnings to you effectively.
Now, without further ado, let's have student nurse Ria to discuss the signs of labor.
Thank you, student nurse Chela. So let's start off with the signs of true and false labor. First-time mothers may wonder when labor may start and how it will feel like. So first, what is labor? Every labor is unique. It is the body's natural process of childbirth that normally begins between 37 to 42 weeks of pregnancy. May mga pagkakataon po na pwede mangyari ang tinatawag natin na preterm labor na nagresulta sa premature na panganganak. So ano po yung preterm labor? Ang preterm labor po ay nangyayari kapag nagsastart po yung mga true signs of labor pagkatapos ng 20th week at bago ang 37th week ng pregnancy. So what are signs that you may be close to starting labor? First, mother might feel the baby drop or move lower in the tummy. Ito po yung tinatawag natin na lightening. So pwede po ito mangyari ilang linggo o oras bago manganak. Maaari din po kayong makaramdam ng pangangailangan na umihi ng mas madalas. Second, the bag of water breaks. So dito po pumuputok na yung panubigan ni baby. Pwede po ito mangyari habang nanganganak o bago manganak. Third, mother may notice changes in the vaginal discharge which may appear clear, pink, or slightly bloody. So, tinatawag po itong bloody show at nagiging indikasyon na lumalaki na po yung cervix kung saan lalabas si baby. Fourth are the contractions. Though there are many signs of labor, one of the most reliable is when strong and consistent contractions start, and this is a main sign of labor. During contractions, the muscles of the uterus tightens and then relaxes. Mothers may start to feel discomfort and pain. Pag nakakaramdam po kayo ng contraction o yung pagsikip, mapapansin po ninyo na tumitigas at sumasakit yung tiyan ninyo. So, some may describe it as strong menstrual cramps. But before experiencing true contractions, mothers go through false labor or what we call Braxton Hicks contractions. So, tinatawag po itong false labor dahil ito ay nagbibigay ng maling senyales o false alarm na ikaw ay nakakaramdam ng totoong contraction o true labor. Braxton Hicks contractions are also referred to as practice contractions. Ito ang paraan ng katawan para maging handa sa panganganak. Normal po ito at kadalasan po nagsisimula ito sa pangalawa o pangatlong trimester. During Braxton Hicks contractions, there is usually tightening in the stomach that comes and goes. Kadalasan po, mild lang ito at walang sakit na mararamdaman. Pero may mga pagkakataon po na pwedeng maging malakas. The contractions usually last for about 30 seconds and helps prepare the cervix for birth, but does not cause labor and open the cervix. So as the due date nears, it's hard to figure out whether or not you're experiencing real labor or just practicing, especially for first-time mommies. So how do you tell the difference between true and false labor contractions? So here are some questions that can help you determine true labor from false labor. It is important to pay attention and learn how to interpret these signs. First is the contraction frequency and interval. How often do the contractions occur? Tuwing kailan po ninyo ito nararamdaman? Second, contraction intensity. How strong are the contractions? Gaano po ito kalakas at kasakit? Third, discomfort location. Where do you feel pain or discomfort? Saan po ninyo nararamdaman yung sakit? Fourth, activity. Do they change with movement or activity? Nawawalo po ba ito kapag nagbabago po kayo ng posisyon o kapag may ginagawa po kayo tulad ng paglalakad? And last is the cervical dilatations. Are the contractions causing changes to the cervix? Nagbabago po ba o lumalaki? So for the contraction frequency in true labor, it happens in a regular pattern. So paano po masasabi na regular ang contractions? Ito po ay kapag yung contraction ay tumatagal ng 1 minuto at ang pagitan o interval sa susunod ay 5 minuto. So during false labor, it happens irregularly from time to time. So bigla-bigla na lang po siyang nararamdaman. Just like what I said earlier, Braxton Hicks contractions come and go. It often happens in the afternoon or evening, and there are no real patterns. So for the contraction interval, in true labor, it gradually shortens, meaning habang tumatagal po, mas lumalapit po yung pagitan bago yung susunod na contraction. For the false labor naman po, it does not get closer. Hindi po lumalapit yung interval ng unang contraction sa susunod na contraction. Next, the contraction intensity. For true labor, it gradually increases. Habang tumatagal po, mas lumalakas po yung contractions na mararamdaman. For false labor, it does not increase and gets stronger over time. Next, the discomfort location. For true labor, pain is usually felt on the lower back and abdomen. For false labor naman po, discomfort and tightness is only felt in the abdomen. Next, the activity. In true labor, it continues no matter the activity. Hindi po nawawala o nababawasan yung sakit kapag nagbabago ng posisyon. In false labor, it is often relieved by sleeping or walking. Dito, nawawala o nababawasan yung sakit pagkatapos matulog, magpahinga, o maglakad. Maaari din ito mawala kapag nagbabago ng posisyon. So, lastly, the cervical dilatation. In true labor, cervical dilatation is achieved, meaning lumalaki po yung cervix kapag nakakaramdam kayo ng contraction. In false labor, cervical dilatation does not change. So, if you think you're going into labor, what should you do? First thing to do is to stay calm and relaxed, then call your partner and let them know. It is also important to check everything you need and make sure you have your hospital bag with you, which will be further discussed later. So when should you call your doctor? First is that if you think your water has broken, may it be at home, at work, or anywhere else for that matter. It can be hard to tell if your water has broken. Some pregnant women think that it is their water breaking, but it's actually just urine. Importante po na tawagin ang doktor para malaman kung anong pwedeng gawin dahil maaari pong magkaroon ng infection o komplikasyon. Second is if you are experiencing bleeding or bright red discharge. So when your due date is near, you might notice clear, pink, or slight discharge as I mentioned earlier. This is normal because the cervix begins to thin out and stretch out. Mahalaga pong magpunta tayo sa doktor sa oras pong napansin nating nag-ibang kulay na po yung discharge. Lastly, if you start to experience regular contractions, when you think you're starting through labor, start timing your contractions by writing them down or have someone do it for you. Just like what I said earlier po, strong and regular contractions are a main sign of labor. So that's it for the signs of true and false labor. So let's have student nurse Christia to discuss the stages of labor.
Thank you, Ria. So now we are going to move on to the labor basics and stages of labor. So there's a total of 3 stages for our stages of labor, namely the first stage, the second stage, and the third stage. So we will first start with the first stage of labor. So ano yung first stage of labor? So the first stage of labor is the opening and thinning of the cervix to be ready for delivery. So dito yung pagbukas ng cervix at also yung pagnipis niya po para po maging ready po ito sa pag-deliver kay baby. And among all the stages, this is the longest one. Ito po yung pinakamatagal, and it is further divided into three phases, namely the latent phase, the active phase, and the transition phase. So, we have the latent phase first. So, ano ba yung latent phase? So, sa latent phase, dito po nagdadilate yung cervix up to 0 to 3 centimeters. And the contractions occur every 5 to 30 minutes. Also, this lasts up to 20 to 40 seconds, and the rhythm is irregular. And there can also be an observance of brownish or pale pink vaginal discharge. So for the first time mothers po, or yung tinatawag nating primigravida, matagal po yung latent phase nila. It takes up to 8 to 10 hours. And sa mga mothers naman po na nagka-pregnant na before, ay mas short po yung sa kanila. Only 5 hours lang po yung latent phase nila. Also po, additional, yung latent phase po ay minsan hindi naramdaman ng mother, hindi po nila alam na nasa latent phase na po sila. Kasi po, mild lang po yung contractions dito, and yung discomfort po ay manageable. So ano po ba yung ma-expect natin sa latent phase? So si mother ay very happy, excited po siya, alert, and slightly anxious. And like I said kanina, yung discomfort ay manageable. So what can the mother do? So the mother can walk around the house to ease the pain of contraction, of course, mag-relax at be comfortable. So dito rin po sa phase na ito ay nagpe-prepare na po ng damit, nag-i-empake na po sila para po sa stay nila sa hospital. And for the mothers naman po na may mga children na maiiwan sa bahay, ay pwede na po silang mag-leave ng instructions sa guardian para magbantay sa anak nila. Habang po nasa hospital si mother and usually si father din. So, dito po sa phase, may mga mothers na po na yung nagpapacheck up sa hospital. Especially the first-time mothers. Kasi po, may nararamdaman silang kakaiba. So, of course, minsan mag-worry ka. And you have to go to the hospital and check. So, kung nasa hospital po si mother, may mga nurses na po ay tinuturuan na si mother about the breathing and pushing techniques. So, ano ba yung breathing and pushing techniques for delivery? So, yung breathing techniques natin po ay may tatawag natin Lamaze breathing. So, paano po ito? So, si mother ay mag-inhale through her nose slowly and exhale through her mouth slowly din. So, yan po yung Lamaze breathing. Ini-ease po ito yung pain of contractions. For pushing techniques naman po, so i-instruct po si mother na mag-deep breath and hold it up to 10 seconds. So while holding her breath for 10 seconds, the mother is going to push as hard as she can. So yan po yung pushing techniques natin. So after po ng latent phase, nasa active phase na po tayo. So ano ba yung nangyayari dito? So the cervical dilatation is now about 4 to 7 centimeters. And contractions occur every 3 to 5 minutes, and it lasts up to 40 to 60 seconds. So the rhythm is now more regular, and there is pink bloody mucus or show that can be observed. So for primigravida mothers, it is up to 3 to 6 hours, and for multigravida mothers naman, 4 hours. So what are we going to expect here? So si mother ay mas serious na and demanding. Mas alert na din po siya dahil po yung pain ay nag-i-increase. So, sa phase na rin po ito ay magbe-break yung water. So, the water may break in this phase. And usually, this is also the time that the mother will go to the hospital. So, in the hospital po, ay na-assist na po si mother sa pag-cope with her uterine contractions. She's going to be showered with words of encouragement. She's going to apply the breathing techniques. And of course, voluntary relaxation of muscles or yung pagmamasahe ng muscles niya, lalo na po sa back, sa buttocks, and sa thighs. So the mother is also encouraged to keep her bladder empty because a full bladder can prevent the uterine to contract properly. So frequent position changes is also encouraged to the mother to ease the pain. And of course, there is a continuous assessment of the woman's vital signs and the baby's fetal heart rate. So there is also an administration of IV para po sa fluids and medications ni mother as needed na po yan. And Yung pushing techniques po dito ay tinuturo if ever si mother ay hindi po nakapunta sa hospital nung latent phase. So dito po yan tuturo yung pushing technique sa active phase. So after ng active phase, we have the transition phase. So the cervical dilatation here is now up to 8 to 10 centimeters, and the contractions is every 2 to 3 minutes. And it lasts up to 60 to 90 seconds, and the rhythm is regular. So there is also bloody mucus or show that can be observed. So for primigravida mothers, the transition phase is up to 2 hours, and for multigravida mothers naman ay 1 hour lang. So what are we going to expect here? So the mother is going to be very irritable. Nagpapanik na po siya. There's a feeling of anxiety, feeling of loss of control, and intense discomfort. Kasi sobrang sakit na po yung nararamdaman ni mother. And it is because that the uterine contractions are at its peak intensity. So the focus is entirely on the task of birthing the baby, and the mother may not comply with the instructions easily. So there is an irresistible urge to push, pero the mother should not push until the cervix is dilated up to 10 centimeters because may possibility po na mag-swell ang cervix and lalo na po itong hindi magbukas. So the mother would be provided with lots of support and encouragement, and of course she's still applying the breathing and relaxation techniques. So after po ng first stage natin, especially po after ng transition phase, we now go to the second stage of labor. So this starts when the cervix is fully effaced and fully dilated at 10 centimeters and ends after the baby is delivered. So dito na rin po yung pag-bulge ng perineum and yung crowning. And yung crowning po ay ito po yung makikita na po yung scalp ni baby sa vaginal opening. So the contractions in the second phase last up to 60 to 90 seconds, and it occurs every 2 to 3 minutes. So for primigravida mothers, this stage, the duration of this stage is up to 1 to 3 hours, and for multigravida naman na mothers ay 20 minutes lang. So here we are going to have an intense pressure for birthing the baby. And the mother is going to be assisted also of the proper positioning. And dito po ay i-apply na ni mother yung pushing techniques. So si mother ay take ng deep breath and hold it to 10 seconds to push. And the push should only be when there is contraction. Slow breathing should be between the intervals para po ay masisave po ni mother yung energy niya for the next contractions. And of course, words of encouragement po kay mother. So after po nun ay third stage of labor. So this is also known as the placental stage. It starts from the delivery of the baby and ends with the delivery of the placenta. So this stage is very short and easy. So it lasts about 5 to 15 minutes, and the longer duration should be avoided dahil po ay ini-increase ito yung risk of hemorrhage or bleeding and infection. So placental stage is divided into two. Unang-una muna ay yung placental separation. So, babalik dito yung contractions dahil po ay nagsaseparate yung placenta sa contracting wall. And normal lang po dito yung blood loss. So, after po nun ay yung placenta expulsion. So, yung placenta ay nagsisink to the lower vagina and it is expelled using gentle tractions on the cord po. So, what are the signs of placenta delivery? So, there is a firm uterine contraction, umbilical cord lengthens also, sudden gush of vaginal blood, change in uterus shape to globular, and the placenta can be seen in the vaginal opening. So what to expect here? So the mother would be assisted in the relaxation for the delivery of the placenta, and in-encourage po dito yung skin-to-skin contact para po ay ma-promote yung bonding and breastfeeding kay baby. So dito rin po ay may cultural considerations. So tinatanong po dito si mother kung ano po yung gagawin sa placenta, if pwede na po bang itapon or iuwi po nila kasi may cultures po ay inuuwi yung placenta. And of course, kino-congratulate si mother sa pag-deliver kay baby. So after po ng third stage, ay may tinatawag po tayong immediate postpartum. Dahil po, yung first 4 hours after birth ay tinatawag nating fourth stage. And ito po ay critical kay mother. So, check po dito yung vital signs and minomonitor po if may excessive bleeding si mother. And ina-emphasize din dito yung importance ng breastfeeding, ambulation, and newborn care. So, yun lamang po about the stages of labor. And next, we're going to discuss about managing labor pain by student nurse Cherish.
So ngayon, pag-uusapan natin, paano nga ba na-manage ang labor pain? Paano ba natin babawasan ang sakit? Sige, pag-uusapan natin yan. So ngayon, isipin muna natin, ano nga bang pakiramdam mga anak? Ayon sa nabasa ko, they felt like increasing bad period cramps. Paano pagsakit ng puson? Nasa bawat minuto daw, lalo na sumasakit. Yung isa naman, felt like being stabbed with a dull knife. O diba? Parang nakakatakot. Kaya naman, pag-uusapan natin, paano nga ba natin i-relieve yung pain? O kahit bawasan man lang natin yan. So, may dalawa tayong options, medicated at saka natural. So, medicated options include epidural, spinal block, analgesics, general anesthesia. Para naman sa natural options, walking, controlled breathing, birthing ball, tub or shower, essential oils, massage, visualization, and music therapy. So first up, we have epidural. Ito yung pinaka-common na way para i-relieve ang pain pag in labor ka. So, paano nga bang process nito? I-ask ka ng anesthesiologist mo na humiga ng side lying, o yan naman, medyo tutuwad. At ang gagawin nila, lalagyan nila ng pampanab yung likod mo before mag-insert ng catheter. Doon sa catheter na yon, dadaan yung gamot. Ano bang effects ng epidural? So, inanam lang nito yung lower part ng belly button mo. So, ibig sabihin, nagagalaw mo pa yung feet mo, pero wag mo na tayo tatayo. So, kahit safe to, may mga side effects din. This includes hypotension, sore back, at saka po headache. Spinal block. So, pwede po siyang gamitin mag-isa o kaya kasama po natin ang epidural. O pagkasama pong epidural, tinatawag natin combined spinal epidural. Kasi po same po to sa pagdaan. Similar lang po siya sa epidural. Same lang po silang dinadaanan. Same catheter po sa likod. So, ang difference lang po talaga nila, pag ginamit po natin epidural, ito lang pong lower part ng belly button lang po ang mangingimay. So, ang main difference lang ng spinal block at saka ng epidural is, ang spinal block, pag ginamit natin, the whole lower half portion ng body, ngimay, walang maramdaman. Pag epidural, at least yung legs, pag hinawakan mo, medyo may naramdaman kang pressure. Kaya naman, ang spinal block, pwede siyang gamitin in both normal delivery at saka sa mga CS section. Sunod, analgesics, also known as pain reliever. Kaya alam natin na sa pain reliever, nandun na yung term nagre-relieve siya ng pain. Sa mga puntes, usually daw pinapadaan nila sa IV. Take note, ito po ay nagre-relieve ng pain, pero hindi pa naman po niya kayang i-eliminate. Next up, we have general anesthesia. So, lahat po ng minention ko beforehand, lahat po sila pwede kayong conscious throughout the delivery so you can see the baby when they come out. Per in general anesthesia, tulog po talaga kayo Ito naman po kasi ginagamit pag emergency C-sections talaga. Kasi ito po yung pinakamadaling process, mabilis lang po itong ilagay sa patient. So next up, nasa mga natural options na po tayo. We have walking. Take note po, ito pong walking, hindi lang po limited sa walking. Lahat po ng exercises na you have to move around, included po dapat po dito. So bakit maganda ang walking? Walking can help bring on labor, can help baby move down into the pelvis, stimulates the release of oxytocin, and can help baby be in a better position. So it stimulates our oxytocin, and ang oxytocin po, tinutulungan po tayo sa mga contractions para mas bumilis po yung labor natin. Mas irregular niya po yung contractions natin. And by walking po, due to gravity, si baby, unti-unti na pong, malapit na pong ianak, ready na po. So, ayun po. Kita po natin sa second picture. Sa first picture pala po, sorry. Yan po yung tinatawag nating cephalic position. Yan ang pinaka-ideal na position ni baby para pag nanganak, ang ulo muna ang unang lalabas. And what we want po pag naglalakad is, sa second picture, pansinin niyo po, si baby po above the horizontal line. Now, what we want po is the baby's head is to go beneath that. Ibig sabihin po, ready na po kayo for delivery. And by walking po, na-speed up niya po yung process na yan. Next up, we have controlled breathing. So po, sa pag-controlled breathing, nagre-release po tayo ng endorphins. Ano nga bang endorphins? Ito po yung natural hormone natin na nagre-relieve po ng pain. So, kaya siguro po pag tayo na nga, parang lahat ng sakit sa mundo, parang nawawala. Saka po, pwede po kasi ang pag-breathing, lalo na po yung pag sinasabi ng inhale, exhale, madidistract si mother na, ay, may kailangan akong gawin, kailangan ko sundin si nurse. Sige, ganon. Pag ganon, nadidistract sila sa pain. At saka po, maganda po to, kasi sa paghinga, nabibigyan natin ng oxygen ng utak natin, and oxygenated brain is a happy brain. So, may mga common types po tayo ng breathing. Lamase, abdominal breathing, pattern breathing. Lamase po parang isa po yung guide sa pag-breathing. Tapos, included po dyan, abdominal breathing at saka pattern breathing. Ang difference naman dalawa is, yung deep and shallow breaths at saka po yung pattern. Sunod up, we have birthing ball. Alam niyo po yung mga nasa yoga, yung malalaking bilog. Yan po yung, pwede po yan sa mga anak, birthing ball. So, ano maganda sa birthing ball? It can help relieve back pain, stress, and pelvic abdominal pain. Speeds up the opening of the pelvic muscles. Tapos may 2 types, round balls and peanut balls. Katulad po na sabi ko kanina tungkol sa walking. Anything that helps you move around will speed up the labor pain. Will speed up the labor process. At syempre po, dahil po nag-exercise kayo, nag-release po kayo ng endorphins, yun, masaya. So, first up, nakita niyo po doon sa picture in the left side, that's the normal birthing ball, the round, the one we usually see in yoga. Tapos po yung peanut, yan po, kita natin medyo may bewang. So, ito po mga positions po to pag ginagamit ang birthing balls. Yung una po, sitting on the birth balls. Pag po nagsisit po sa mga ganyan, kailangan po i-make sure nyo steady po yung ball para hindi lang po kayo biglang gugulong doon sa palabas. Tapos yung po susunod, leaning on the birth ball. Pag po nagliliin, dapat po medyo mataas yung pagtutuunan nyo kaysa doon sa bola. Tapos pwede nyo ask the partner nyo o kaya anyone you want na medyo yung hilot yung likod kasi masakit nga. So, sunod, leaning over the bed with birth ball. Hindi po nakita masyado sa picture, pero nakatayo po yung patient, tapos nakatuon lang po siyang ganon. Ang mga peanut ball naman po kasi, maganda daw po yan sa mga patient na dahil po sa isang circumstance, hindi masyado makatayo. Kaya nilang gamitin yung birth peanut ball habang nakaupo. Ito naman po, isa po siyang nurse na nagde-demonstrate kung paano nga ba po ang side lying with peanut ball. Next up, we have shower. Siguro naman naramdaman natin to lahat na pag nag-shower parang ang sarap sa pakiramdam, presko. Pagkanta din syempre din ito kay mother. Nakakapag-relax talaga to. At saka, lagi nang na-mention, it can help the fetus shift position. Yung kaninang tinuro kong cephalic position. Anything exercise can help your baby. At saka, ang plus pong maganda sa pag-shower, na may maintain natin yung good hygiene ni mommy. Sunod up, we have essential oils. Ang essential oils po, gagamitin yan natin sa aromatherapy. Yung pong pag may inamoy ka, parang nawawala lahat ng sakit mo. Baka may naalala ka, o baka gusto mo lang talaga yung amoy. So, ano maganda sa essential oils? This will help reduce anxiety and nausea and pain. Yun nga, sabi ko, dahil sa pag-aromatherapy, nakakawala siya ng mga problema mo. Pwede ding maganda din siya dahil nakakapag-project siya ng peaceful and calm environment kay mommy. So talaga naturally, relax si mommy, which is also good for the baby. So ito po, ilang halimbawa lang po na pwedeng gamiting essential oil. Ito po mga essential oils na promote po ng labor contractions include lavender, ilang-ilang, at saka po sage clary. Tapos po naman po, kung gusto niyo ng pang peaceful environment essential oil, pwede pong mint, frankincense, o kaya citrus. Throughout this po, pag kayo, kunya may gusto po kayong ibang scent, I recommend po na i-search muna. Kasi po hindi lahat po na scents, medyo hindi po healthy. Hindi okay kayo sa pregnant mother. So, sunod at pala po, we have massage. Ano nga ba pong massage? Di ba po ma-relax talaga to? We all know this, kat di tayo buntes. I-relax tayo, lalo na kung tense yung muscles mo. So, ito lang po, may interesting facts na ako na-share about bakit nga ba, about these two theories. Gate control theory, ito daw po yung, alam niyo po yung dandahan lang po na hilot. Kunyari, dandahan lang yung haplos. Parang ang sarap sa pakiramdam. Kasi po, na-redirect natin yung brain. Ay, ako yung, malambot lang yung hawak sa akin. Parang pleasurable yung feeling. So, nawawala ang sakit. Pagdating naman sa diffuse nauseous inhibitory method, ito yung, pag naghihilot, sobrang diin. Naiisip ng brain, ay, nasasaktan ako. Naturally, si brain, magre-release siya ng endorphins. And endorphins, as we said before, natural pain relieving hormone natin yan. So, mawawala naturally ang sakit ni mommy. So, next up, we have visualization. Maganda po to kasi nakaka-retain na expectation at nakakaging natin, nagagawa natin optimistic si mother sa future. Naisip niya, ay, lahat ng sakit na nararamdaman ko ngayon, pag lumabas ng anak ko, pagiging worth it lahat. So, yung mindset na ganon, very powerful po yan. To the point na nababawasan yung sakit na nararamdaman mo. So, last up, we have musical therapy. Kung si mommy naman, medyo mahilig sa music, pakinggan natin ng music. Kasi isa sa mga music therapy, nakakapag-distract siya sa pain, nakaka-create ng peaceful environment kay mommy, nare-relax si mommy. So anything that relaxes mommy will be good for the baby. And will also distract her from the pain. So ayan, dyan ako nagtatapos. Next up, we have Ayen talking about the labor and delivery process in the Philippines.
So for our next topic, what happens during labor and delivery? So before we proceed to our main topic, there are important things that must be discussed before your labor and delivery. So one of it is where to give birth. Pwede po ninyo pag-usapan ng inyong partner or husband kung saan po kayo pwede manganak. Hospital is the most preferred option. Giving birth can be costly, especially in private hospitals, but some government hospitals offer free maternity services to the local residents of their municipality. Kaya lang po mayroon po mga requirements to be qualified to avail the free maternity services like proof of residency and PhilHealth. Next is lying in clinic where licensed obstetrician will take care of you. Pag naman po nakalocate ang clinic sa mga rural area, usually po experienced midwife will take care of you. Sila po magpapanak sa inyo. Next is home birth, giving birth at home with the midwife or a nurse by your side. However, it is not recommended due to risks that may arise while giving birth or after you give birth to your baby. So it suggests that if your choice is really give birth at home, you should have a ready access to transportation to nearby hospital if ever complications will arise. So there are things that are important to bring to your labor and delivery. For mothers, comfortable nightgowns and bathrobe, going home clothes, socks and slippers. If possible po sana yung socks, yung non-skid socks po. Bras and nursing bras, nursing pads, nursing pillow, maternity panties, maternity pads, hair ties and toiletries, birth plan and other important documents. For baby, going home clothes, receiving blanket, diapers, changing mat, baby socks, baby hat, and car seat. Other important things to bring, mobile phone and charger, and money. So going back to the birth plan and other documents. Birth plan is important because the healthcare providers that will take care of you will be able to know your preferences during your labor, while giving birth and after the delivery. But there are possibilities po na hindi masusunod yung mismo nasa birth plan ninyo. Maaring labagin sa policy ng hospital or clinic, pwede rin pong dahil sa kulangan ng facilities na available. Or pwede rin pong pag nagkaroon po ng complications sa pagbubuntis ninyo, at maaaring baguhin po ito ng mga nag-aalaga sa inyo para po sa kapakanan ninyo ng baby. So, other documents needed. Some institutions will ask for admission slip, your birth plan, PhilHealth, government IDs, marriage certificate if available, and maternity package and newborn package is also good to include in your birth plan. Usually, these are the inclusions in the package in a private hospital. So, hindi po lahat ng hospital, ganito po yung package. Iba-iba po yung package nila. At iba-iba rin po yung presyo. So, upon arrival at the facility, i-access po kayo ng nurse or ng midwife. Itatanong po sa inyo ang inyong buong pangalan, araw ng kapanganakan, rason kung bakit kayo nagpunta, at sino ang mga kasama ninyo sa labor room or delivery room. Alamin din po na nurse or ng midwife kung preterm or term labor po kayo. If preterm, you will be administered with antenatal steroid. Kasi po, pag preterm po, for the 7 weeks, the lungs of the baby doesn't have surfactants yet, meaning it will going to be difficult to function properly. So, who can be in the delivery room with you? It really depends on the policies of the hospital or clinic. Most hospitals allow the husband or the partner to accompany the pregnant woman in the delivery room, but in other institutions, mostly government institutions, are strict about who enters the sterile area. Sterile area, the labor room, and the delivery room. So it is important to ask beforehand if your husband or partner can stay with you. Katulad nga po na sinabi ko kanina about birth plan, kung naka-indicate po sa birth plan ninyo na ang gusto ninyo ay may kasama kayo sa delivery room, usually your partner, pero sa policy naman po ng hospital, ang mga anak lamang po ang dapat nasa delivery room or sa sterile area. So it really depends on the hospital's policy. So the common chief complaints during labor, kung lahat po yan ay naranasan o kahit isa lamang po dyan o dalawang po dyan, ay nag-labor na po kayo. Hypogastric pain, bloody vaginal discharge, and watery vaginal discharge. So upon admission, woman in labor is asked to change into patient's gown used in sterile area. Yung oras po na na-admit kayo at kung ano yung rason, ay nire-record po ito. So if you're in labor, you will stay in the labor room until you are about to give birth to your baby. Pag po nasa labor room na, magkakaroon po ng history taking, tatanungin po kayo ng nurse. Pero sa ibang facility po, ito pa ginagawa na po sa receiving area pa lamang. Lalo na po kung nagsisimula pa lamang po kayo mag-labor. Also, health teachings will be discussed, kasama po rito yung breathing techniques, at maaari rin pong ituro sa inyo ang tungkol sa pag-breastfeed at paano alagaan si baby. Monitoring vital signs, titignan po yung blood pressure ninyo, pulse rate, respiratory rate, temperature ninyo kung nasa normal range ito. Ima-monitor rin po yung progress po ng pag-labor. At maaari pa rin po kayong kumain at uminom, ngunit light meals lamang po. Pero depende pa rin po kung may order po na hindi po kayo pwedeng kumain. At i-administer po ng IV fluid para hindi po kayo ma-dehydrate. Kung cesarean naman po, hindi po kayo dapat kumain at least 6 hours before the operation. Pinapayagan pa rin po yung posisyon na kung saan kayo komportable. At syempre po, hindi po ito dapat makakasama sa baby. Patuloy pa rin po pag-monitor sa inyong vital signs at sa pag-labor po ninyo. Pero nire-recommenda po na i-admit lamang po ang buntis kung nasa active phase na pag-labor. Active phase po, tulad na nabanggit kanina, second phase ng first stage of labor. Pag 4 to 7 cm na po yung cervical dilation. And a companion during labor is also recommended and in an upright position that was already discussed in the previous topic. So in this picture, it shows different upright positions that can be done during labor. So next is the transitional phase. There are already frequent strong contractions here that you will experience. Hindi na po kayo na-allow na tumayo o maglakad at pumunta ng comfort room or bathroom. Nakahiga na lang po kayo. Assessment for signs of impending delivery of the baby, appropriate management of prolonged labor, hypertension, abnormal presentation, and bleeding. Dun po i-assess po kung ano po yung interventions na gagawin po sa inyo. Kung maaari po yung prolonged labor po. Pag hindi po kayo nanganak, ay maaari po maging post-term na po ito. So, cesarean section is necessary. In the delivery room, so usually you will be transferred to the delivery room with a stretcher or wheelchair. and the pregnant woman is transferred depending on their parity. So pag first time po ninyo na manganak, pag 10 cm pa lamang po ay ang cervical dilation, doon lang po kayo transfer sa delivery room. Pag naman po nanak na sila, ang hindi nila po first time manganak ay 7 to 8 cm pa lamang po, ay kadalasan ay na-admit na po kayo sa delivery room. Jewelries and dentures are removed at kung meron man po, ibinibigay po ito sa inyong kasama. Sina-check rin po ang inyong kuko kung meron po kayong nail polish. Kung meron po, inaalis din po ito. So in the delivery room, active management of the second stage of labor will be done by the medical team. It starts with 10 cm labor dilation and ends with when the baby is delivered. So it is recommended during delivery in an upright position. Selective episiotomy. Episiotomy should be performed selectively, not routinely. Episiotomy po, it is a surgical cut in the perineum during childbirth to enlarge your vaginal opening. Sa pagka-deliver po ni baby, tutuyuin po siya at lalagay po sa inyong dibdib at tinatawag po natin itong unang yakap. Unang yakap will be discussed more by our next presenter. Pag po nailagay na si baby sa inyong dibdib, ay tatakpan po kayo ng kumot and to prevent heat loss na rin kay baby. So after the delivery, active management of the third stage of labor will be done. Administration of uterotonic, yung oxytocin po, within 1 minute after the delivery of the baby. But before po i-administer ang oxytocin, ipapalpate po muna ang inyong abdomen para po malaman kung meron pa pong isa pang baby na nasa tiyan po ninyo. Placenta is delivered by controlled contraction with countertraction sa uterus, and uterine massage will be provided after the delivery of placenta. Provision of immediate postpartum nursing care. So after the delivery, magpapalit po ulit kayo ng hospital gown if nasa hospital po kayo. If nasa mga lying-in clinic naman po, after few hours ay pwede na po kayong umuwi. And rooming in, checking vital signs. Check pa rin po ang vital signs niyo even after the delivery of the baby. And rooming in with the baby in the case of non-problematic cases, or if the baby is preterm or having serious condition, he or she needs to be confined at the newborn intensive care unit. So that is what happens ideally during labor and delivery. And for the last topic, EINC Protocol, it will be discussed by student nurse Chella.
Magandang araw sa inyong lahat. Ako po si Student Nurse Chella at tatalakayin ko po kung ano ang EINC Protocol. What is EINC? Ang EINC po ay Essential Intrapartum and Newborn Care. Kapag po sinabing intrapartum, ang ibig sabihin po nito ay ang panganganak. At sa Pilipinas, kilala po ang EINC bilang unang yakap o the first embrace. Ang EINC din ay package of evidence-based practices recommended by DOH, PhilHealth, and WHO. At ito rin ay standards of care in all births to ensure optimal care for health of newborn babies and mothers. Para po ang EINC sa ating mga nanay at ang kanilang mga sanggol. What are the time-bound interventions of EINC? Ang mga interventions na kasama sa EINC protocol ay ang immediate drying, skin-to-skin contact, proper cord clamping and cutting, non-separation of baby from mother, and breastfeeding initiation. Doon po tayo sa unang-unang intervention na immediate drying. Pagkatapos ng kapanganakan ni baby, agad na tutuyuin si baby ng mga nurses sa loob ng 30 seconds. Kailangan ang pagtutuyo ni baby para hindi siya magka-hypothermia. Ang hypothermia ay ang biglaang pagbaba ng temperature ni baby at mabilis na giginawin si baby. Kapag gininaw si baby, maaaring na makasama sa kalusugan niya ito. Kaya pupunasan ang muka, mata, ulo, harap ng katawan, likod ng katawan, braso, at ang kanyang mga binti. Ang rubbing motion o yung pag-wipe kay baby ay mag-stimulate na rin kay baby para siya ay umiyak. Ngayon po, dun sa ikalawang intervention na skin-to-skin contact. Pagkatapos po umiyak ni baby at pagkatapos niyang matuyo, at kung in-assess naman si baby at walang abnormalities at normal naman po si baby, wala nang ibang gagawin na manipulation tulad ng suctioning kay baby. Dahil kapag po may ginawa pang ibang manipulation, maaari po na mag-cause pa ito ng trauma o ng infection kay baby. Ngayon po, ang skin-to-skin contact ay ang paglalagay kay baby sa dibdib ng ina. Habang si baby po ay nakadapa sa dibdib ng kanyang ina, ito po yung tinatawag nating unang yakap. Habang nakadapa rin po si baby sa dibdib ng kanyang ina, ay tatakpan si baby ng blanket at lalagyan ang ulo ni baby ng bonnet. Ngayon, makakatulong ito para hindi lamigin si baby. Lalagyan na rin si baby ng identification band sa kanyang ankle at sa kanyang kamay. Na gagawin ito para maiwasan ang pagpalit ng bata sa ospital. Sa slide na ito ay makikita natin kung ano ang benefits ng skin-to-skin contact. Ano nga ba ang pakinabang ng skin-to-skin contact? Dito, may tataguyod na agad ang bonding ng ina sa kanyang bagong panganak na sanggol dahil mayayakap na agad ni mommy si baby. May tataguyod na rin ang success ng breastfeeding. Ang colonization with maternal flora, ang ibig sabihin lang nito ay ma-expose si baby sa normal at mabuting germs na meron si mommy. At ang germs na makukuha ni baby ay makakatulong para sa immunity ni baby. At dahil meron na tayong successful breastfeeding, may iwasan na rin ang hypoglycemia sa bagong panganak na sanggol. Sa ikatlong intervention, ang proper cord clamping and cutting. Hindi agad kinugupit ang umbilical cord ni baby. Aantayin muna ng mga nurses na tumigil ang pulsations na meron ito. At kapag tumigil na ang pulsations, lalagyan ito ng dalawang clamp na ikakabit ng 2 cm at 5 cm mula sa tiyan ni baby. At pagkatapos ikabit, ay pwede na itong gupitin. Ngayon, pagkatapos magupit ng umbilical cord, titingnan ng mga nurses kung meron bang pagturugo ang umbilical cord. The umbilical cord must not be milked towards the newborn. At 10 IU, IM, oxytocin is injected to the mother. Ang oxytocin ay nakakatulong upang mag-contract ang uterus ng nanay. Ngayon, ano po ang benefits ng proper cord clamping and cutting? Ito po ay nakaka-prevent ng anemia sa mga bagong panganak at nakakababa ng rate ng intraventricular hemorrhage o pagdurugo. Ngayon, doon naman po tayo sa panghuli at ikaapat na intervention o non-separation of baby from mother and breastfeeding initiation. Early initiation of breastfeeding is done when baby is showing signs that it is ready. Makikita po natin ang mga cues and signs ni baby na gagawin niya para malaman ni mommy na gutom na siya. Ang mga ito ay licking, tonguing, or routine movements at kilala ito bilang feeding cues. Kailangan malaman ito ng kanyang ina upang malaman ng ina kung kailan ang tamang oras pakainin si baby. At inaanyayahan ang mga ina na itulak o i-nudge kaunti ang newborn sa nipple. Dahil ang mga newborn ay merong breast crawl o meron silang abilidad na mahanap ang nipple ng kanilang ina kapag nilapit sila sa dibdib. Habang nag-i-initiate ng breastfeeding, tuturuan po ng mga nurses ang ina kung paano ang tamang attachment at latching ng baby. Tuturuan naman po si mommy ng mga nurses kung paano ang tamang pagbe-breastfeed, lalong-lalo na ang positioning at attachment ni baby. When the newborn is ready to breastfeed, the nurse will advise the mother to make sure the neck of the newborn is not flexed or twisted. Newborn must be facing the breast with the chin touching the nipple. Ang sanggol po dapat ay nakaharap sa breast ni mommy at ang baba ng sanggol ay nakadikit sa nipple ni mommy. Hold newborn close to the body. Ang paghawak po sa sanggol ay dapat malapit sa katawan ni mommy. Support the whole body of the newborn. Dapat po ay suportado ang buong katawan ng sanggol habang nagpapa-breastfeed. The newborn's mouth must be opened wide before moving newborn towards the breast. Lower lip must be below the nipple. At kapag handa na po ang baby na mag-breastfeed, dapat sisiguraduhin natin na nakabuka ng malaki ang kanyang bibig bago siya ilapit sa nipple ng nanay. At ang lower lip ng baby ay dapat nasa ilalim ng nipple. Meron naman pong signs of good attachment na makikita kapag tama ang pagbe-breastfeed kay baby. Unang-una, malaki po ang buka ng bibig ni baby. Ang lower lip ni baby ay naka-turn outward. Ang baba naman po ni baby ay nakadikit sa breast ni mommy. Ang suckling po ni baby ay slow, deep, at merong paghinto ng kaunti. At ang nanay naman po ay i-assess ng mga nurses kung tama ang attachment at tutulungan naman po siya na maayos ito. Maraming salamat sa pakikinig at sana ay marami kayong natutunan sa aming childbirth health education.